You did your yearly blood work and your results came back normal. You got a clean bill of health and you think that normal means healthy. But what I have learned over the last 20 years working as a clinical pharmacist, that the disease does not happen when you get abnormal test results. And often you have years of developing silently disease while your test results come back normal. Chronic diseases, especially those four horsemen of death, cardiovascular disease, diabetes, dementia, and cancer, they develop years, if not decades, before anything shows up abnormal on your blood work. The problem is, the standard tests are great as far as diagnosing a disease once it already has happened, but not so great at identifying the early markers of the disease that's already happening at the cellular level. Hi, my name is Dr. Adriana Kekic. I am a pharmacist and nutritionist trained in genetics, and I've spent the last 3 decades obsessing and studying sciences of genes, molecules, and longevity. I used to work at the leading hospital in the country, and now I help people who want to invest and own their health through advanced molecular testing and personalized protocols based on 6 pillars of lifestyle medicine. In this video, I want to share the biomarkers you should know about if you care about your cardiometabolic health. If you're not sure what cardiometabolic health means, well, continue watching the video and I'll explain that in more depth through these biomarkers. I'm going to share some of my top biomarkers that I typically will check that will give you a better indication at what's under the hood, oftentimes years before, God forbid, you end up with the diagnosis of some chronic disease like those 4 horsemen of death. They're a better and early predictor of cellular decay or damage that's happening at your standard blood work. Also, can indicate disease developing oftentimes years before those symptoms appear. The problem with standard testing is that we're so focused on diagnosing a disease that even when we check a biomarker that might be on that standard test, we may not be paying close attention to those early markers of what's going in the wrong direction, what's trending in the wrong way. That is not to say that your standard test does not hold value. It certainly does. But we need to make sure that we're interpreting it not only in the context of if you have a disease or not, but rather in the context of a trend, meaning preventative health. I have spent years trying to figure out really what's going on inside of my own body and why so many of my family members have been ridden with chronic diseases, including not only myself, but also both of my parents. What I'm sharing is exactly what I wish somebody shared with me many years ago, which would prevented me almost dying. Story for another time. In short, if there is one lever that you can pull on that will expand your health span or number of years that you live in good, vibrant health, then it's going to be the cardiometabolic health. So the best way to explain it is to go through these biomarkers. Starting with one of the most important biomarkers of not only your metabolic health, but your overall cardiometabolic health, the one that is rarely checked. And that biomarker is fasting insulin. Fasting insulin is more predictive of prediabetes, diabetes, and overall insulin resistance than the standard biomarkers that we use like fasting blood sugar and A1C. Hemoglobin A1C is an average of your blood sugars over the last 3 months. If your A1C is in between 5.6, 5.7 to 6.4, you're kind of in that category of prediabetes. Once your A1C exceeds 6.4, so 6.5 and above, you get a diagnosis of diabetes. Here's why fasting insulin is more important and an early indicator of insulin resistance and if you are at risk of developing these chronic conditions. When you eat, your blood sugar rises. This sends a signal to your pancreas, which then pumps out insulin. Insulin is a hormone that will then come in and bring that blood sugar down to safe levels. In people who are no longer metabolically healthy, and that is 93% of us Americans, What happens is the cells are no longer responding to knocking of insulin. You see, insulin comes in, knocks at the door, serves really as a key that will open up a cellular door. Once the door opens up, then the sugar that's floating in your bloodstream will enter through those doors and get inside of those cells, especially muscle cells and brain cells, fat cells, and more. In muscle cells, it can be stored for energy. In fat cells, typically it's stored for later as a storage. So if you're metabolically unhealthy, your cells are no longer responding to knocking of insulin, and pancreas starts to pump more and more of that insulin, which basically translates into rising levels of your fasting insulin. This is good for a while because the more insulin you have, the better blood sugar control you're going to have. And that's exactly where the problem is. You see, if we're only looking at your blood sugar, meaning those two biomarkers I mentioned, so the fasting glucose and A1C, they can actually be normal for years as long as your pancreas can continue to secrete insulin that will continue to bring that blood sugar down. The problem is the insulin itself. You see, insulin doesn't only bring blood sugar down. Insulin is a storage hormone, which means it stores sugar that the cell will take up and then store it as fat. Secondly, insulin also sends inflammatory signals throughout the body that can damage your blood vessels and cause also cellular damage. So in brief, normal blood sugar does not mean that you are metabolically healthy. Normal blood sugar can mask the metabolic storm that is happening in your body, and oftentimes for years. My second concern with relying on these standard tests is the overall effect of cumulative damage that happens from this years of ongoing exposure to high insulin. The reason I say that is early detection of insulin resistance makes that insulin resistance reversible. So by the time you're diagnosed with diabetes, lifestyle alone may no longer cut it, and some of that cellular damage may no longer be fully reversible. This is especially true if the beta cells of pancreas, these are little cells that are pumping that insulin. If those beta cells start getting exhausted, damaged, or dying, you no longer can produce the counterbalance to blood sugar, which is your insulin. And if at this point you're wondering, Dr. Adriana, why is this not checked? Well, it's not part of standardized, routine, affordable diagnostic testing. And our healthcare system is really geared more towards diagnostic and treatment of the disease rather than catching early signals and preventative health. When you speak with your doctor, have that conversation and see, am I a good candidate for fasting insulin check, especially if I have either family or close family history of insulin resistance, prediabetes, and more importantly, diabetes and cardiometabolic diseases. Insurance companies will typically pay for this test, especially if it's ordered by or referred by your physician, and if not, cost usually is between $15 to $70. Another biomarker that goes hand in hand with fasting insulin is something called high sensitivity C-reactive protein. You see, this protein is an indicator of chronic low-grade inflammation. A lot of standard tests will include this C-reactive, high sensitivity C-reactive protein. However, we're typically more focused on higher levels of the hs-CRP because they can indicate acute infection or really acute ongoing inflammation due to some other maybe cause that still needs to be unveiled. And that's the tricky part, because having levels that are elevated, and that can be anything above 1, can indicate inflammation, stress, infection, a lot of different things. High sensitivity CRP is a rather covert biomarker because it is at the center of almost all of these chronic diseases, especially the 4 horsemen: cancer, cardiovascular disease, diabetes, and dementia. And I say it's covert because it's not something that you typically can feel. It doesn't usually cause fever or pain. You don't necessarily feel the hs-CRP levels being high. Optimal levels of high sensitivity C-reactive protein are below 1, especially if we're targeting health span. And high levels indicate increased risk of cardiovascular disease, including heart attacks and strokes, over the next 10 to 20 years. What is important here is not only the number itself, but rather your trend over time. And that part, understanding your trend, are you trending in the wrong direction or the right direction, applies to virtually all of your biomarkers, especially those related to cardiometabolic health. So, those that can indicate your risk of insulin resistance and heart disease. In the following video of the cardiometabolic biomarker not routinely checked, I'm going to tackle those related to cardiovascular disease related to lipids. And no, I'm not going to talk about either triglycerides to HDL ratio or HDL or LDL. I'm going to talk biomarkers that are stronger predictors of the overall cardiometabolic risks that you may have. Until the next video, know your cells, know yourself.